Hello and welcome again for an online study of fundamentals of anthropometry. As I told in the first session of fundamentals of anthropometry, we are four speakers to complete this subject on anthropometry. Myself, Dr. Rosario Pascal D'Souza. I am going to complete two chapters. We have seen the introductory part of anthropometry in session A. The chapter 1 of anthropometry is completely allotted for introduction and definition of anthropometry. So, I have completed session A of chapter 1, that is introduction on anthropometry. Now we will go to session B of chapter 1, and that is definition of anthropometry in details. We have studied the introductory part of anthropometry in details in session A. Now in session B, we will study complete definition of anthropometry. Anthropometry is the measurement of human body, measurement of alive human body. It is one of several approaches which also include biochemical, clinical and dietary assessment, which are used to assess nutritional status of an individual. Anthropometry can help identify the types of malnutrition present in an individual or present in the population and measure progress toward improvement. Here the malnutrition means bad nutrition. It may be less, it may be more. Nutritional status of a single individual or nutritional status of the whole population, like whole population of a country, whole population of the world. That is why this subject is having big scope. However, it does not identify specific nutrient deficiencies. Now you all know that the nutrition of human beings consists of macronutrients and micronutrients. Macronutrients are proteins, carbohydrates and fats, whereas minerals, vitamins and water, they contain specific micronutrients like iron, different vitamins, vitamin A, vitamin B and lots of minerals. But the anthropometry has got limitations to find out these specific nutrient deficiencies. So for that purpose, we require other methods to measure them. Macronutrients can be assessed through anthropometry. Now let us see what are the types of anthropometry. There are basic two types of anthropometry. Commonly used types: static type and dynamic type. Static and dynamic anthropometry are also referred by the names as structural and functional anthropometry. These terms which more explicitly express the body and its action. Static dimensions are taken with body parts held in a fixed and standardized position, whereas in dynamic anthropometry, the body parts are not fixed and moving for understanding the action. So, structures are related to anatomy and functions are related to physiology. So, this is how these two types helps you all to understand anatomy and physiology also. Remember these two types, static type and dynamic type. Now, what are the importances of anthropometry? Why do we study anthropometry as a separate subject and a subject for elective? Apart from clinical usages, the anthropometry plays an important role in industrial designing, clothing, designing of clothes, ergonomics, and architecture, where statistical data about the distribution of body dimensions in the population are used to optimize products. For doctors, anthropometry is useful in clinical usages for all health science personnel. But anthropometry is not only limited to health sciences. It is also beneficial in industries for designing architecture. Like I am wearing a suit today, which is a ready-made suit, but I got it in a showroom which fits me. That means through ergonomics, these companies, these industries, they have designed such kind of clothing where you can select one which fits you. That means these industries and those companies who releases the products, they have studied anthropometry. So same thing goes with other utilities which human beings use. All the devices. We'll come to that one by one. So see, now anthropometry is moving from clinical uses to the industrial designing and architecture. So ergonomics is another branch of study of anthropometry, which is about the relationship between the human and the product. So humans are available in different sizes and shapes, stature, constitution. Similarly, a suitable product has to be designed for them. The best example is clothing. With clothes, you look better with appropriately chosen clothes. Now, these days are of ready-made clothes. Now we don't go to a tailor every now and then. What tailor does, is also anthropometry. He takes measurement of your body and he sews a suit for you, suitable suit, and that fits you. So that is also anthropometry. In ergonomics, the products which are produced and brought in the market are easy to use and comfortable. And this is ergonomics. Every device, every instrument which human being use, all vehicles, two-wheeler, four-wheeler bicycles, the arrangement of chairs, the chairs which we sit on, all the benches, they are available in the market before taking your measurement, because they are available in different sizes and shapes, and those are prepared by the companies, industries, in order to make you available a suitable device or instrument or a furniture. Anthropometrics is the science of using body measurements to make product for comfortable feel and easy uses. So anthropometric science is also useful in industries. So we are shifting from clinical uses to other uses. People are given a task to design a new product that you don't think is ergonomic using anthropometric data. Yes, they use anthropometric data to design a new product. So we are using those products, and here the anthropometry is helping the industries to make those products available for us. Well, in the previous session we have studied what measurements are actually required. But to go in the depth, anthropometric measurements includes the measurements of body weight. It can be dry weight for dialysis patient. Now the dialysis patients who suffer from renal diseases, for that purpose dry weight is required. Height of a person or triceps skin fold. You all know that arm has got anterior compartment and posterior compartment. In posterior compartment there is a triceps muscle. Above it there is a skin. So that fold circumference we have to measure, or biceps skin fold circumference, or abdominal circumference. Calf means circumference of legs. Mid-arm muscle circumference, or breadth of elbow. Subscapular skin fold behind. So these are all anatomical terms. Below the scapula, the subscapular region, or above, around the scapula, the skin fold has to be measured. Anthropometric measurements are quite simple and more or less very easy also. And those can be used on any individual of any age. Even children who are more anxious about all these tests, but they go well with anthropometric measurements because this method is non-invasive. If compared with other methods of assessing nutritional status, the measurements are quite quick and easy to make using relatively cheap and simple equipment. You will see the equipment later in this session. They can be made by relatively unskilled people as well. By this time, you know what is anthropometry. You know what is anthropometric measurements. Do you find it difficult to measure somebody's body size, say proportions? Is there high skill required to measure the body? A body can be measured by unskilled people also, by giving them a simple training. So anthropometric measurements can be done, of course, by the doctors. They are the main people here in our study. But nurses can do it, the assistants can do it, ward boys, even IAs can do that if they are taught properly. So it's not a skillful job. Anybody can do it. And plus it is non-invasive. We don't need scalpels to cut the skin, what we do during dissection. We use needles, scalpels, cannulas, scissors. Here nothing of that kind is required. All are plain and simple devices. And probably that is why neonatal anthropometry is also quite easy. Now let us understand what are the neonatal anthropometric parameters. You all know that neonatal means newly born babies. Neo means new, natal means birth, soon after the birth. Anthropometric parameters are recorded by using measuring tapes, weighing scales, which are balanced beforehand, and also Anthropometer is available for the measurement of length of a baby. It can also be adjusted beforehand. So in a newly born babies, we use anthropometry. You all know that when the baby takes a birth, everyone asks two questions. What is the sex? Is he a boy or is he a girl? And what is the weight of the baby? But other things are also measured nowadays with the help of Anthropometer. Usually these neonatal anthropometric parameters are taken within 72 hours of birth. So can say soon after the birth, these parameters are required to assess the status of a baby. Now, what is anthropometric data and what role it plays? Anthropometric data plays a crucial role in designing the products, designing the workspaces, and interfaces that accommodate diverse human body sizes and shapes. Now you see me, I am sitting on a chair in front of you. Now this chair suits me. So this is a product designed in such a way that it feels comfortable to you. All the workspaces now are the days of science and technology. You see a lot of space suits, satellites. They are designed in such a way that suits all the astronauts. So human body sizes and shapes are different, so the driver's products are made available with the help of anthropometric data. In the earlier session, I also told you about ergonomics. Ergonomics experts utilize anthropometric measurements to optimize the design of furniture, different tools, different types of vehicles, ensuring optimal comfort, safety, and performance. So you don't have to give an order to any automobile company to prepare a vehicle for you. Already those vehicles are available, manufactured by the automobile companies, and you have to select one which deems fit for you. As far as the optimum comfort is concerned, optimum safety is concerned, and optimum performance is concerned. So you get easily available these products, including different types of furnitures and vehicles and different tools which you use in our day-to-day duties, because ergonomics, they utilize anthropometric measurements. For the sake of making it a science, anthropometric equation is formulated. You can see the formula here: total body weight and body volume and so on. Now it is developed and its internal validations are also confirmed. With the help of this equation, we can find out the exact body size and proportion. Total body weight in kilograms equal to 5.249 plus 107.502 body volume length plus 0.289 weight in kg plus 2.0156 in male 1 and in female 0, r raised to 2 equal to 0.91, RMSE is equal to 1.885 kg. Those who deal with anthropometry responsibility, they use this equation and find out the exact status of an individual. With the help of this exact status of specific population is also anthropometric science helps us for the measurement of the population's dimensions. The population dimensions are obtained based on the population's size. and strength capabilities and differences among the population. There are three ergonomic design principles which are based on anthropometry, and they are design for a range, design for the extreme, and design for the average. The word extreme means towards both range and average. So range, extreme, and average, these are the three ergonomic design principles based on anthropometry. Further, anthropometric measurements can be used to describe particular human physics. See the word physiques, physics, which is known as somatotype. Soma means body. Somatotype, types of bodies. So based on this, we have three somatotypes: endomorph, ectomorph, and mesomorph. You will get endomorph somatotypes, human physics; ectomorph somatotype, human physics; or mesomorph somatotype physics. Nevertheless, some individuals may also present a hybrid of two somatotypes. So endo and ecto together, endomorph and ectomorph, or ectomorph and mesomorph. So accordingly, we get fourth category and so on. But basically, there are three somatotypes based on anthropometric measurements. Well, now we will understand what are the anthropometric measuring tools. We call them as anthropometric devices. Anthropometric measuring tools are required to measure the body, and accordingly, these tools and devices are designed for the usage of anthropometric measurements. As the name goes, because we are dealing with the study of anthropometry, so we have an anthropometer, and the common tool is personal scale, the scale which you carry with you. The personal scale is also of benefit. And there are different types of calipers, like spreading caliper or sliding caliper. Vernier caliper is quite common. Soft metric tape, Shakir's tape, different calipers for the measurement of skin folds. There are many more. Here you can see the images of different measuring tools for anthropometry. You may not have heard these names, you may not have seen these tools earlier. Very simple tools which we use in our compass box during our school days, they are also included in this kit. There is an angle locator, there is a pressure gauge, there is a laser level, there is a inclinometer, of course there is a protractor also, and the machine they use measure square, that is also available for us in anthropometry. Angle gauge, micrometer which we have studied in physics, compass which we have studied in geometry, vernier caliper, level measuring tool, simple tape measure or simple measuring tape. These all they make measuring tools. But the calipers are much more important. We will see other anthropometric measuring tools and how they are basically used while doing anthropometric measurements. Here on the top we can see a anthropometer. Below that you can see a sliding caliper large, sliding caliper small, spreading caliper, goniometer, a simple tape. They all make anthropometric measuring tools. Here is one image to show you the body composition and anthropometric measurement with the help of one caliper. Usually the practitioners and doctors, they use their pinch on the abdomen, especially on the flanks, and they measure the size of skin fold. But that you cannot put in a specific parameters, and for that purpose we have a skin fold caliper which can give you exact reading. So this is commonly used nowadays to understand the body composition and then further to diagnose it, which is required for a treatment and for the purpose of prognosis. But what is physical anthropology? Now, one of the principal technique of physical anthropology is the discipline originated in 19th century when early studies of human biological and culture evolution stimulated an interest in the systemic description of populations both living and extinct. Living population which is available easily, readily, but the extinct population is studied by excavations, by archaeology, where the fossil study is mandatory. So here you can understand the anthropology, and that for that purpose we have to use anthropometry in measuring those bodies. Little more about history of anthropometry. It includes its use as an early tool of anthropology. So I told you in the first session itself that anthropology is a big branch of study as a subject, used for identification, used for the purposes of understanding human physical variation in paleoanthropology and in various attempts to correlate physical with racial and psychological traits. So through this we can understand the physical status of different races and their psychological traits. Now let us understand what is the clinical importance of anthropometry again, because we have taken fundamentals of anthropometry as an elective optional elective for our health science course. These anthropometric measurements, they are used to determine a human being's nutritional and general health status. By taking measurements, we understand the nutritional status and also the general health status of human beings. Measuring weight and height of infants and children is an international health practice that provides a readily accessible, inexpensive, objective method to ascertain the health history and health status of a child. So, the main target of anthropometry, as far as the ages are concerned, are children, and mainly the children below the age of 5 years. We call them under 5. So 0 to 5 is the main target in anthropometry, because they provide us the health status of children across the globe. But there are some limitations also in anthropometry. Though it is non-invasive, simple and easy, the main shortcomings are anthropometric assessment. The assessor who assess the anthropometric measurements, whether they are intra or inter observer, as far as the variabilities are concerned, which tend to diminish the validity. You cannot say 100% valid. They diminish the accuracy, so 100% accuracy and precision of the technique which is used. So all the readings may not be precise, may not be accurate, so may not be valid because of intra and inter observer variabilities. Short limitations are there for anthropometry. Nevertheless, there is a good scope for anthropometric measurements, because they are used to assess the body size and body composition. The measurements are simple, safe and non-invasive, and they provide information on past exposure, but cannot detect short-term disturbances or deficiencies of a specific nutrient. We have seen it earlier. Vitamin A deficiency, vitamin C deficiency, vitamin D deficiency. The specific deficiencies cannot be detected by anthropometry if they are very recent. Specific nutrient deficiencies like deficiency of proteins leading to protein energy malnutrition, which further leads to marasmus, muscle wasting, but there is a long-term disturbance. Otherwise, there is a good scope for anthropometry to assess the body and to diagnose it and to further treat and make a prognosis about it. Anthropometric measurements cannot identify exact protein deficiencies or exact micronutrient deficiencies. They can't detect small imbalances or disturbances in nutritional status, nor they can identify small changes in the proportion of body fat in order to learn body mass. These are the further limitations for anthropometric measurements. Well, anthropometric measurements cannot identify exact protein deficiencies or micronutrient deficiencies. They can't detect small disturbances in nutritional status, nor they can identify small changes in the proportions of body fats in order to learn body mass. So these are the small limitations in anthropometric measurements. Well, there are 7 variables in anthropometric assessment where the characteristics are assessed by using a battery of 7 variables. One is arm span, we call it as AS. Other is body height, we call it as BH. And the other is body weight, we call it as BW. The next is waist circumference, we call it as WC. The other is hip circumference, we call it as HC. And next one is waist to hip ratio, which is called as WHR. And finally BMI, and that is body mass index. So these are called as battery of 7 variables. Anthropometric measurements include weight, height, body mass index, body circumference, circumference of arms, circumference of waist, circumference of hips, circumference of calves, waist to hip ratio, WHR, elbow amplitude, knee heel length. All these anthropometric measurements also helps a lot to the orthopedic surgeons for the purpose of orthopedic surgeries. Now, what is the difference between length and height as far as the precision is concerned? Length denotes how long the shape is, and the height denotes how tall the person is. So length is the horizontal measurement in a plane, whereas height is the vertical measurement in a plane. Height is the most accurate anthropometric measurement. Almost everybody knows his or her height and also the weight. Most accurate measurement means there is a measurement difference of only 0.07 percentage in underweight to normal, 0.04 percentage in overweight, and 0.07 percentage in obese participants. Obese means who are overweight. Obesity, highly overweight. Only height, body mass index, and head circumference were not statistically different when measured by the GPs or the research assistants. GPs means general practitioners, or the research assistants who work in anthropometry. The readings of height, head circumference, and body mass index were not statistically different. Anthropometry is a simple, reliable method for quantifying body size and proportions by measuring body length, width, circumferences, and the skin fold thicknesses. We have seen the different places for body circumferences and skin fold thicknesses. The SF stand for skin fold. So wherever you get this word in short form, you need to remember them. In circumference, SC means hip circumference or head circumference. It needs to be specified. Well, now it is time to understand the relation of nutrition in anthropometry. So we call it as nutritional anthropometry. Nutritional anthropometry has been defined as measurements of the variations of the physical dimensions and the gross composition of the human body at different age levels and degrees of nutrition. So we have already categorized all the individuals into 3: 0 to 5 age category, we call it as under 5, and there is a middle category 5 to 18 or 19, the middle category of adolescents, and the third category is 18 plus and above, including pregnant women and lactating women. So the food requirement, nutrition varies from age to age, and that we need to understand in the nutritional anthropometry. Anthropometric studies can therefore help us to identify the nutritional problems such as undernutrition and overnutrition. Undernutrition means less nutrition or poor nutrition or low nutrition, and overnutrition means a food which is consumed more than required for that person's. And plus, anthropometric studies and also can help us to identify pinpoint groups with specific nutritional and health needs to be assessed in policy development and programming. The policy development is decided by the governments or regulating authorities, and based on that, programming is also done for the purpose of implementation amongst the masses in order to improve the nutritional status. Before we proceed with the nutritional anthropometry, how they help us in anthropometric measurements we have seen several times earlier. But to be precise, height of the body or length of the body, weight of the body, the main part is mid upper arm circumference, which we call commonly as MUAC, demispan or arm span, knee height, sitting height, skin fold thickness, and hair circumference. These are the most common anthropometric measurements. The impact of world changing technologies have given us different and more devices to measure the body. Here you can see one image where a tape is shown to you, which is required for MUAC, mid upper arm circumference. It is available in centimeters. How to measure mid upper arm circumference? That is to be studied by everybody or all the doctors, because it is a common measurement and there is a specific procedure involved in it. I'll show one video on demonstration of MUSE, but prior to that, let me explain to you what is MUSE. Well, here in this image, I am showing you a measuring tape. The impact of world changing technologies have brought different types of measuring tapes to measure MUSE. Now, by this time you know what is MUSE, but let me explain it to you again and how these measurements are taken, that we will see in the next image. MUSE means mid upper arm circumference. This is required more in children because children are more vulnerable for undernutrition, and those children, they suffer from wasting of the muscle, or you can say loss of muscle volume. And for that purpose, these devices, I mean to say these tapes are developed by different companies. The Shakir's tape is quite commonly used measuring tape. Here I am showing you one image where the MUSE is measured. How to measure mid upper arm circumference, that I am showing you through this image. As I said earlier, mostly the children are selected for MUSE. Here left arm is selected. The children get scared, so we have to allay them that this is a non-invasive procedure. So soon they start cooperating to you. And by removing the clothes from upper part of the body, we have to start measuring MUSE. In that case, the left hand has to be flexed at an angle of 90 degrees, and from the posterior lateral side, we have to find out the tip of the acromine process. You know that acromine process is the part of scapula, so you have to go little back side, so posterior lateral. From there, you have to bring tape down to find the lower point that comes on the acromine process, is a part of ulna, and there this specially designed measuring tape, which is available in 3 colors, plus with a window that has to be placed in order to find the midpoint between acromine process and olecranon process. And after finding the midpoint, you have to mark it with the pen, and the next step you have to use that tape to encircle the arm, and that place is mid upper arm. So while doing this, the tape shouldn't be too loose or too tight. So you can see the 1, 2, 3, 4, 5, 6 stages are shown to you, and in the 7th stage you will come to a window. The window has got arrows. The arrows point towards the final reading, and you have to record that reading, and this is what is called as measurement of MUSE. This is very common and everybody does this. This you saw through image. Now I am going to show you one video which I found on YouTube, a free video for education purpose, but with the courtesy of Shivani Rohadge ma'am, the owner of this video who has posted this on YouTube. I would like to play this video for you, and this will show you how MUAC is measured. Please watch it for 1.5 minutes, and then we will continue further.
How to take mid-upper arm circumference. Mid-upper arm circumference, or MUAC, is an important measurement to determine nutritional status and identification of severe acute malnutrition in children. It is taken by non-stretchable tape or using 3-colored tape which has marking on it. 3-colored tape which has a window slit can be wrapped around the child's arm, and reading can be recorded to nearest 0.1 centimeter. The MUAC is measured on the left arm. Now let us see steps to take MUAC. Identify the acromion on the left arm by palpating the bony prominence which extends off the collarbone to the shoulder. If possible, gently move their arm up and down to locate the acromion prominence exactly and mark a point on the tip of the bone. Now, fold the hand to 90 degrees so that the palm of the child is facing up. Mark a point on the tip of the elbow, which is also called olecranon process. Keep the zero of the tape to the acromion point and extend tape down the posterior surface of the arm to the tip of the bony part of the mid-elbow. Identify the midpoint by dividing the upper arm length into half. Hold the tape upright and mark the horizontal point at the midpoint. Now, bring the child hand straight and wrap the tape by overlapping the two ends around the midpoint. While taking MUAC, ensure the tension of the tape should not be too tight or too loose. Take the reading to nearest 0.1 centimeter and record on the case recording form immediately.
Finally, we have come to the conclusion that identifying nutritional status in the population more correctly by calculating opposite score of the measurements, and it is a non-invasive and relatively correct way of identification. And that is why anthropometric measurements are quite beneficial for all the health science workers. And being this topic related to human anatomy, I hope that you are finding it very interesting now. Lots of anatomical terminologies are used in this. And with this conclusion, I conclude this session B of chapter 1. Thank you. Thanks a lot.